What if the vitamin B12 tablet you take every morning is not protecting your brain as well as you think? You may take it for memory, energy, nerves, and red blood cells. But after 65, the real problem is often not how much B12 you consume. It is how much your body can absorb and use. A person can eat B12-rich foods, take a daily supplement, and still develop a hidden cellular deficiency. It often starts slowly with fatigue, forgetfulness, tingling, or slight imbalance, then progresses to affect memory, walking, and independence. In this video you will learn why B12 deficiency becomes more common with age, the warning signs, the medicines that interfere with absorption, and the treatments used to restore healthy levels. Stay until the end, because symptoms blamed on normal aging may sometimes be signs of a treatable deficiency. First, why is vitamin B12 difficult to absorb? In meat, fish, eggs, and dairy, B12 is attached to food proteins. Stomach acid and enzymes release it. It then binds to intrinsic factor, a protein that carries B12 to the final part of the small intestine for absorption. With age, this process can become less efficient. Some older adults produce less stomach acid, called hypochlorhydria, or develop changes in the stomach lining. B12 may then pass through the digestive tract unused. In some people, intrinsic factor is reduced or absent. One important cause is pernicious anemia, an autoimmune condition in which the immune system attacks stomach cells or intrinsic factor. Without enough intrinsic factor, food and ordinary supplements may not correct the deficiency. This is hidden hunger. A person may appear well-nourished while the cells remain deficient. Vitamin B12 supports red blood cells, DNA synthesis, healthy nerves, and energy metabolism, so deficiency can affect several systems. Many people think B12 deficiency causes only anemia. In reality, neurological symptoms may appear before major blood count changes. Early signs include fatigue, weakness, poor concentration, slow word recall, memory problems, and brain fog. They are often dismissed as aging. B12 deficiency can damage myelin, the protective covering around nerves. This may cause numbness, pins and needles, burning feet, reduced sensation, weakness, poor balance, or an unsteady walk. In older adults, these problems increase the risk of falling. If a severe deficiency remains untreated for too long, some nerve damage may become permanent. Doctors commonly begin testing with serum B12 and a complete blood count. Borderline results or neurological symptoms may require methylmalonic acid and homocysteine tests. Now, an overlooked cause: medications. Proton pump inhibitors and other acid-reducing medicines treat reflux and GERD, but long-term use may make it harder to release B12 from food. Long-term metformin use for type 2 diabetes is also associated with lower B12 levels. Monitoring may be needed, especially when anemia, fatigue, numbness, or balance problems appear. So what can be done when absorption is poor? The first step is to identify the cause and severity. A mild dietary deficiency is treated differently from pernicious anemia, intestinal disease, or significant neurological symptoms. High-dose oral B12 can still work through passive absorption. Sublingual tablets or drops are convenient, though not consistently proven superior to standard tablets. Nasal B12 may be suitable in selected cases. When malabsorption is severe, pernicious anemia is present, or neurological symptoms are significant, doctors may recommend injections. Injections deliver B12 without relying on the digestive tract. They are often given more frequently at the start, followed by maintenance doses based on the underlying cause and severity. You may hear that methylcobalamin is the best form because it is biologically active. It is a useful option, but cyanocobalamin is also effective and widely used. What matters most is choosing the correct dose, identifying the cause, and ensuring the chosen form can be absorbed. Dietary sources include eggs, salmon, sardines, milk, yogurt, lean meat, and liver when medically appropriate. However, food alone may not be enough when severe malabsorption is present. Fiber-rich vegetables, oats, garlic, onions, and fermented foods such as plain yogurt may help support a healthy intestinal environment. A daily 30-minute walk may also support digestion and general health. These habits can complement medical treatment but cannot replace it. Here is a practical 5-phase plan to discuss with your doctor. Phase 1. Evaluation. Ask whether you need a serum vitamin B12 test and a complete blood count. If results are inconclusive, your doctor may order methylmalonic acid or homocysteine tests. Testing for pernicious anemia, intrinsic factor deficiency, or other causes of malabsorption may also be necessary. Phase 2. Initial replacement. For people without severe malabsorption, physicians may recommend high-dose oral or sublingual B12. A commonly discussed initial dose is 1,000 to 2,000 micrograms daily for about 90 days, but the exact dose and duration must be selected by a healthcare professional. Vitamin B12 injections may be more appropriate when a person has severe anemia, significant numbness or tingling, difficulty with balance, pernicious anemia, intrinsic factor deficiency, or serious gastrointestinal malabsorption. The physician will determine the number and interval of injections. Phase 3. Nutrition. Aim to consume 1 or 2 reliable sources of vitamin B12 every day, such as eggs, dairy, salmon, sardines, or lean meat. Liver may be consumed occasionally, about once a week, if there is no medical reason to avoid it. Script 23. Phase 4. Digestive support. Consume enough fiber and include oats and vegetables. Add garlic and onions if tolerated. Eat suitable fermented foods like plain yogurt, and stay physically active. These steps may support digestive health and the intestinal microbiome, but they are not a replacement for prescribed B12 treatment. Phase 5. Reassessment. After about 8 to 12 weeks, your doctor may repeat blood tests and evaluate symptom changes. Possible improvements include better energy, clearer thinking, improved concentration, steadier balance, and reduced tingling or numbness. If levels remain low or symptoms do not improve, the treatment plan may need adjustment. Your doctor may change the dose, investigate another underlying cause, or recommend injections. The central message is simple. Fatigue, memory changes, numbness, tingling, and balance problems should not automatically be dismissed as normal aging. In some cases, they may be warning signs of vitamin B12 deficiency. Identifying and treating the problem early can make a major difference to brain health, nerve function, mobility, independence, and quality of life. Never stop a prescribed medication or begin high-dose B12 without medical guidance. However, if you are over 65, take metformin, use long-term acid-reducing medication, follow a vegan diet, have a digestive disorder, or experience neurological symptoms, speak with your healthcare professional about vitamin B12 testing. Protecting your brain and nervous system is not simply about swallowing a tablet every morning. It is about making sure the vitamin is absorbed, reaches your bloodstream, and finally enters the cells that truly need it.